Federal health officials have issued a warning about a mysterious polio-like disease called acute flaccid myelitis. The CDC says more than 60 cases have been reported across 22 states, and most of those affected are children. CBS News chief medical correspondent Dr. Jon LaPook is here with me now. So, Dr. LaPook, what exactly is AFM?
Well, acute flaccid myelitis, it's a fancy term, but basically it means acute, it happens suddenly, flaccid, limbs can go like this, have weakness, and myelitis means inflammation of the spinal cord. And what happens is, for some reason, we're not exactly sure why, you get inflammation of the spinal cord, and the symptoms can be weakness, arms, legs, slurred speech, trouble swallowing, even trouble breathing.
You were telling us a little bit about sort of the symptoms, but how rare is this neurological disorder?
It's quite rare, and I think people need to know that they should be panicking because it's in the news right now. It's fewer than 1 in a million people get this.
Okay.
So very rare. And you might ask yourself, well, why are we seeing this? You know, we didn't seem to see it before. It's just that we're identifying now. First really described in 2014. In 2016, there was the most number of cases so far, but it was still only 149. Of course, if you're one of the people who gets it, I mean, for you, recovery may not be full. In fact, it usually isn't. You can get some partial recovery, but often it's children and they have some ongoing problems.
Why do you think it is, Dr. LaPook, that some people get this and other people don't?
Yeah, that's the million-dollar question. In fact, it's the 10 to 15 million people question, because 10 to 15 million people get a virus called enterovirus D68, which is one of the suspected culprits. Sometimes you find this virus. What is that? It's a virus that's spread by respiratory route. It can cause some upper respiratory symptoms and sneezing and coughing, cold-like symptoms. It can also cause some gastroenteritis, diarrhea, and vomiting. But 10 to 15 million people a year get that.
Wow.
And only very few people, maybe 1 in 100,000. If you think about if up to 150 people a year have been described, maybe there's some more that we're not noticing, but it's really quite rare. If you have 10 to 15 million people a year, and let's say it's 150 cases, that's about 1 in 100,000 people who get the infection actually come down with the problem. So one possible theory is, and I've been doing a lot of reading about this, and I just got off the phone with a researcher from Johns Hopkins, is either the virus directly affects the spinal cord. That's kind of probably less likely, and the reason is they've noticed some families where like 7 or 8 of the people in the family will get the respiratory problem, and yet only one person gets the acute flaccid myelitis. So you would think if it's direct infection, then everybody would get it. And in fact, polio, it's polio-like. This is not polio. With polio, it's a direct infection of the spinal cord, and that's what causes the problem. More likely is that there's some characteristic, maybe a protein, that's shared by the virus and the spinal cord. So your immune system goes after the virus, but it accidentally attacks your own spinal cord. And that's kind of an immune reaction. It's, you call on the troops and you've accidentally had some friendly fire on your own body, and that could be what's going on. It's suspected they've tried to give things like IVIG, intravenous immune globulin, which are antibodies from other people, steroids to sort of dampen down your own immune reaction, but so far it's not really clear whether that's helping or not.
You know, I know this is so absurd, somebody on the train sneezed and I find myself like holding my breath, as though like that's going to protect myself. But
how long can you hold your breath for?
How long can you hold? I know it's absurd. How do you protect yourself?
Well, you protect yourself, I think, not you who've been sneezed at, but the person who's sneezing, sneeze that way. That really works. And don't sneeze into your hands, because you sneeze into your hand and then, hi, how are you?
That's
okay?
disgusting.
And you can get that, and of course you're going to touch your hand to your mouth at some point. So sneeze there, I also think that we need to change our culture. If you are feeling badly, if you are sick, stay home.
I know.
Don't come to work.
I know.
Don't come to CBS News if you're sneezing.
I know.
Stay home.
True.
Everybody would appreciate it. But in general, again, put it in perspective. There are millions of people who get enterovirus D68, for example, but very few people get this problem. Again, I don't want to say that we know what it is. Other possibilities are some genetic propensity, some environmental toxin. So there's still a lot of research that is ongoing. And in fact, I just read hot off the presses, there's 29 case reports from Europe that they've just published of different countries, Sweden and other countries trying to get together and pool their data to find out what's going on. There was an outbreak in Taiwan, so this is not just limited to the United States.
Global, okay. Dr. LaPook, thank you very much for joining us.